Occlusion in Everyday Dentistry is IPSO's Introduction to Occlusion course. What sets IPSO apart from all the other occlusion-based CE programs is that we're very hands-on in our teaching philosophy, with our motto being hands-on on your patients in your hometown. The 3-day Introduction to Occlusion seminar is designed for the development of effective occlusal skills, and we hope that by the end of the program, you'll feel that what you've learned will enable you to be more effective in your diagnosis of occlusion, TMD, and airway disorders in your own practice. The basis of this course is to help you, the restorative dentist, but also the periodontist, orthodontist, endodontist, pediatric dentist, prosthodontist, and the lab tech, handle the problems that you may see day to day when treating patients. I have patients say to me all the time, well, what's IPSO? I've never heard of you before. And I tell them that we're probably the oldest occlusion and TMD based CE organization that you've never heard of. We don't advertise, we don't market, we're strictly word of mouth. We only hold courses when enough dentists come to us and ask us to hold a course for them. In one form or another, though, we've been around for about 50 years, starting with the teachings of Niels Gachet and his Science of Occlusion seminars, and in 2000 branching off into IPSO, but still with the philosophies of Niels Gachet. They're tried and true techniques that have stood the test of time. So let's briefly discuss the outline of the OED 3-day course. Starting off with a brief history of occlusion may sound a bit like a waste of time, but for those of you who have looked into occlusion at any level, you've come to learn that there's a lot of differing philosophies out there on how to manage an occlusion and what the occlusion should even look like. We find it's extremely valuable for our attendees to understand how occlusion got that way and helps open your mind as to why different groups do things in different ways. Occlusion isn't just about how teeth fit together. It's about the interactions of teeth, the periodontium, the muscles, nerves, joints. So a review of the relevant anatomy and how it relates to occlusion is a good starting place. Physiology and biomechanics of occlusion helps you to go beyond the what and understand the why. Why do occlusal interferences and parafunction cause all that damage? Once you begin to understand why, you can begin to implement occlusal principles more effectively and help your patients understand how they'll benefit from management of their own occlusion. Of course, to treat an occlusion, you need to know how to recognize the signs of occlusal disorders, and only then can you begin your diagnosis and treatment planning. Centric relation is the cornerstone, and it's impossible to have a stable interference-free occlusion without a stable joint. We'll spend considerable time over all 3 days discussing centric relation, how to find it, how to record it, and how to use it in your diagnosis. Seemingly every day, dentistry is learning more and more about airway and its implications into occlusion, and vice versa. Keep in mind that this is an occlusion course and not a TMJ or an airway course, but it's impossible to teach occlusion without addressing the other two. We'll also discuss airway issues and how it relates to the practice of occlusion. And even though this isn't a TMJ course, that doesn't mean we won't teach about joint diagnosis and pathology, and even how to manage some of the more basic TMJ issues. Without a healthy joint, it's pretty difficult to have a healthy occlusion. So we'll show you how to recognize and diagnose sick joints. It's important to know what's going on in the joints because it's just as important to know what not to treat as it is to know what you should be treating. You'll get a better idea, a better understanding of articulators and what all those settings mean. You'll begin to get an appreciation for how all those settings can help you diagnose better and how they influence your dentistry. The most conservative definitive occlusion care is the occlusal equilibration, and you'll be completing an equilibration on standardized mounted casts. There are many types of occlusal appliances, all the way from the custom fabricated occlusal deprogrammers, the prefabricated deprogrammers, to the full arch occlusal appliances. Even airway management appliances are also occlusal appliances, and we'll discuss why. We'll take a deeper dive into the world of occlusal instrumentation and how to use it even more accurately. This little machine up on top, this is called the Cadillacs, made by Danar, and it's an electronic jaw tracking device. It's used for more complex dentistry. But what if you're just doing a couple of crowns and don't have advanced instrumentation? We'll teach you alternatives to quickly and cost-effectively get more accurate information into your articulator, and while not as accurate as advanced jaw tracking devices, it's far more accurate than using average values. If you're going to diagnose and treat occlusion and TMD problems, you'll need to know how to collect the data. We'll show you how to complete a comprehensive occlusion and TMJ exam and how to properly and effectively document it, and how to utilize that data in your diagnosis and treatment planning. We'll wrap up with occlusion and how it fits into a philosophy of comprehensive dental care. We all practice just a little bit different from each other, so we'll give you the tools that you need to be able to think your way through how occlusion-based philosophies can fit into your style of practice. We incorporate many hands-on experiences and demos, so gowns, masks, gloves, face shields will all be available so you can safely experience those demos with your fellow attendees. OED is a 3-day program held on a Friday, Saturday, and Sunday, and it's only held upon request by a group of dentists interested in taking our courses. IPSO is a CERP-approved provider, and you'll receive 21 hours of CE credit for attending this course. Tuition is $19.95, and it includes one additional auxiliary team member. We really encourage you to bring along either your chairside assistant or your hygienist. A course commonly taken after OED is Applied Occlusal Principles 1. AOP is a true hands-on course, and this is what sets IPSO apart from all the other CE providers. Over 4 weekends, typically spread over the course of 6 months, you'll treat a total of 4 of your own patients. 3 will be in centric relation occlusal appliances using 3 different types of appliances, as well as equilibrations on those patients. The final patient will be a patient with a displaced disc, and we'll teach you how to manage it. Tuition for AOP 1 is $11,329, and it also includes an auxiliary team member. IPSO courses are not the typical learning experiences in which you just pick up a few pearls along the way. This is a highly structured, immersive experience that's intended to change the way you view and practice dentistry forever. Even if you never perform any of the procedures we teach, you'll never see dentistry again the way you did before you became involved. We hope to see you soon as you begin your journey into the world of occlusion. You can register on our website at ipsoseminars.com.